Good morning. Thank you for joining Consumers Doctor. And my main focus has been total freedom and healthcare. And I've been talking quite a bit on the total freedom and healthcare. And what I'm looking at is the insurance. How do you achieve total freedom? We need to focus on our health insurance and health coverages. Right now, right now, the health insurance coverages are based on sharing the potential risk among the large group of clients, large entire population. Even you're paying for your uncompensated care at the hospitals, you're paying for people with no insurance, you're paying for illegal Americans, you're paying for all that. That's how the premiums are based on, because insurance companies disperse the risk among the entire population of their business. Wherever the business is, they share that risk among the entire segment of the population. That's a problem, folks. That is a problem. And I've been bombarding with the same thing over and over, because you can't do that. But the insurance companies, who's going to tell the insurance companies to change their practice? You and me can't do that. This is my problem. This is where we need to be smarter. And how do we achieve this? If they don't change their habits, I would just drop off the insurance coverage, folks. I will not buy that coverage. I would switch to HDHP. HDHP is called Health Disclosure, Healthy Premium. I renamed it. It's not a high deductible plan anymore. For you and me, for all my clients, all my listeners who are saying, I call it as a health disclosure, healthy premium. HDHP accounts, I was googling it. Normally it's $156 for a well category individual. For well, average, 62% of the population are in the well category. So we can get that $152 premium as an individual for a family. If you're self-employed or you're working for any firm, large and small, you can also request for a HDHP account payments, because don't buy this traditional insurance. Traditional insurance is a hard wash, folks. It's not the right premium, because the way I see it, they basically keep raising the premium because you're getting older. They have that's just not going to work. What I would do is switch it to, and a family of 4, the premium is $750. You can put up to $750 a month, and which goes a long way, folks. By the year end, you should have around $8,000 to $10,000 for a family to protect your family. And I want to take care of myself and my family and take care of. So if you're personally covering yourself, $156 starts at $156 for well category. So if you get that, this insurance industry is all, entire healthcare is so dysfunctional, because the premiums are based on how many people there. I don't blame the insurance company. You can't blame anybody, because there are 28 million illegal Americans, and there are several, 15% of the Americans can't even afford their health insurance. So that's how their premiums are based on. Insurance companies have to cover their losses. How do they cover the? By taxing you, so they can collect and they can survive. It's a matter of survival. For insurance companies, it's a matter of survival. Unless Congress acts, there's no other thing we can do. So by having an HDHP account, you can save money and put aside into Health Solutions Advantage. That's the beauty. So every year you can put aside $3,600, $4,000 as an individual, up to $8,000 to $10,000 per a family. Can you imagine 10 years from now how much you will have it in your own health solutions advantage account? It's called HSA. Go to any brokerage. You can go to Fidelity. I was told Fidelity has an HSA. Anybody can open it. And as a consumer's doctor, I can help you setting it up. I can also help you setting up HDHP accounts. This is where I'm passionate about it. This insurance premiums are based on broad category. They're not segmenting the risk, folks. Insurance companies are not segmenting the risk. We need to segment the risk. When you do the segmentation, well category, 62% of Americans are in the well category. And their claims are so low. Percentage-wise, the claims are only 12%. By population-wise, it's 48%. And 15% have no claims. 15% have no claims, but they're paying the premium. So there is a second category. It's called at-risk category. At risk. Your premiums have to be based on at risk. At risk. People with smoking, blood pressure, overweight. This is where you need to get personalized, folks. If you have a personalized health coverage, you will watch your weight like a hawk. You will watch your diet, watch your thing. You will focus on your fitness. You will focus on your health. It will make people focus on their health. So at-risk people are smoking. They need to quit smoking, man, and so that they can be healthy. So their premiums can be lower. That will entice them to quit smoking, lower their blood pressure, watch their diet, fitness, and your premiums are lowered, man. Your premiums are lowered. You can save money. Put aside whatever your premium is based on that. They can put aside. Again, HP accounts are affordable even for this category, at risk category. I strongly encourage everybody to participate in HDHP. It's not high deductible. It's not high deductible. You can basing on your economic status. You can put initial start at $500,000. You can raise up as long as you can pay from your pocket or pay on the side. Well, ultimately, Health Solutions Advantage will pay out-of-pocket expenses, but initially, either employer pays it or whoever pays it. But it needs to be somewhat deductible. You have to start with a lower deductible, $500 this year, next year $1,000, maybe following year $2,000. Increase your deductible so your premiums are lower. This is for at-risk category, folks. The third one, this is where the tricky part is. Chronic illness category. Your premiums, when insurance companies looks at people, they underwriters look at what is your health status. This is where Affordable Care Act has done I think I commend certain things from Affordable Care Act. What is called guaranteed health coverage, pre-existing illness, transition from parental to individual, major medical coverage, catastrophic. That's all elements are embraced along with this chronic persistent illness. Okay, chronic illness, the total number of population-wise, 16% of the population have chronic illness. Illness like asthma, diabetes, heart disease, mental health. 16%, folks, their claims are 20%. Actually it's 41%. I'm sorry, 41%. This is where the cost goes up. Insurance companies looks at it. Hey, you belong to this chronic illness category. Your premiums are going to be higher. But even then, if you buy high deductible health insurance policy, basing on your affordability and deductible part, Again, start with a lower amount and build it up. And I would rather pay it from my pocket, man, and just keep your premiums lower and keep all your bills. If you're paying for your medications, paying for your doctor, keep all your bills. The time comes, you can pull that money out without any penalty. So that's the beauty about keeping your bills. Keep it for 10 years, 15 years, no matter how long. At the age of 65, when you retire, put all those bills together. Withdraw that money without any penalty from the Health Solutions Advantage HSA account. hdhphsa.com. Okay? And it's healthinsurancepersonalized.com. This is where I'm focusing on healthinsurancepersonalized.com. What it does is HDHP, HSAs, combine the HDHP and HSA into health disclosure, healthy premium with Health Solutions Advantage. You set it up simultaneously so you qualify for HDHP. So that's where the claims are from chronic, 41%. That's where your cost. But in traditional insurance, people with chronic illnesses, their premiums are a lot higher, folks. You know why? They're paying for the uncompensated care. They're paying for illegal Americans. They're paying for the hospital charge. The cost keeps going higher and higher because our Congress, every time they pass rules, certificate of need, this and that, it costs. Every time they pass a new law, it costs you and me. What is the certificate of need? If you want to open a grocery store, you need a certificate of need. Hospitals have to have a certificate of need. Come on. If you want to, I understand. The government has to have an oversight, but they're not supposed to be regulating. Oversight is the main thing. As Ronald Reagan said, government is a problem. It is a problem because when they don't do oversight, they regulate it from the bench, from the Congress. This is where it becomes a problem. But we need to have government oversight. That's where focus should be. But government job is not to provide you guaranteed health. That's not the government job, folks. It is you and me. We're all independent. We want to be free. We take care of ourselves. Americans in general take care of their own health. They're hardworking people. They're making money. 180 million blue-collar workers. They're making money. They're hardworking, and they're employed subsidized. And the government subsidized 70 million on Medicare, veterans, you name it. They have a government subsidy and federal government. They're all government subsidized. But even then, government job is not to regulate. Government job is to provide tools for Americans so they can take care of themselves. It's an oversight. But when government starts, like Medicare, I'll give you the example, beauty, but Medicare spends my money, hard earned after 35 years. I paid into the Medicare. You know what? They I'm not talking about Social Security, folks. I'm talking about my Medicare money is being pumped into intermediary organizations, which is not right. Give it back, that $1,200 to me. I can take care of it. I don't need Medicare to take care of me. AARP, listening. If you're listening, focus on, demand the Americans they should get reimbursed for $1,200 instead of wasting money on this stupid intermediary organizations like billing companies, managed care company. They're taking your money and restricting the care. I don't like it. I just don't like being restricted. This is my health. I know what I'm doing. I can take care of myself. I don't need somebody to tell me I should go to this doctor. Come on. That's not going to work for Americans. Americans in general are hardworking, decent, are responsible people. We need to stop regulating. Give us the tools. then we will take care of them. We want to be free, man. We all want to be free from the shackles of healthcare. They said, oh, everything is free. We don't want your handouts. Give us the tools so we can take care of ourselves. This so-called Affordable Care Act is nothing to do with healthcare, folks. I don't know where you're getting this idea of universal. Medicare itself is bureaucratic, man. Medicare is wasting my money, your money, and everybody else. Medicare, CMS, if you're listening, CMS is wasting my money. You know why? I stayed in the hospital for a 23-hour stay, and I got a bill from the hospital for $227,000, folks. 200. And you know what? Medicare has the audacity to pay 35 grand of my money. I could have had this procedure done if I was in charge to half the price, or maybe 1/3 the price. And why hospitals have no choice but to, because of they're providing this EMTALA, law of EMTALA, instead of government taking care of it, they put it on the burden on the hospitals. Hospitals have no other choice, but they spread the losses along with everybody. So what I'm saying is, you really need to have a control on your health. Hospital bill of $227 for 23-hour stay, it's not. And on the top of it, they collected another 25-30 from my supplemental insurance. So they made 60 grand for a simple angioplasty. Come on. 227? I could have had it done for under 10,000 or 15,000. I don't need a hospital for that. I would have go all over the country. I would go across Canada, have it done a lot cheaper. I don't need this and billing, surprise medical billing. That's another beauty. These billing companies need to be gone, man. 9,000 billing companies milking the system. They are spending your money and they're billing these intermediate organizations. Why do you think the costs are going up? We are spending 17.8% of the GDP, $3.7 trillion being wasted every year. Why don't you invest in us? Put that money back in us. Come on. I'm smarter to take care of I can probably teach all Americans to be independent. I can bet you it's coming. Americans are smart. They can handle it. Give that $3.7 trillion back to us. We will handle it. We don't need government. We don't need the government. We want our own thing. We want to save for our future. You're wasting. Government is wasting your money. I don't like that. So let's focus on this, folks. I keep bombarding with the same old theme, but I believe me, this is my job. I work for a non-profit organizations called Foremost Organizations, and are willing to provide health care for average folks, low-income folks, handicapped, lower-income category. My goal is to achieve freedom in healthcare, especially in the lower-income people. Every time I see these people in Los Angeles, San Francisco, with their that's the only position they have, folks, in the shopping cart, with their clothes. They don't have anything. Why can't the government focus on that? Give them the life insurance. The least they can do is, how much does it cost to get 100,000 life insurance? A couple of $100? Why can't they give free life insurance to the lower income people? So that way, if their families, if they're gone, it should not be a burden to their family. Why can't? That's the least the government can do. I'm an independent. I don't want to be between left and right. I think I'm seriously thinking of being independent, because they're the one who decide the next elections. They're the one who decide. Independence in this country decide the fate of the country, man. Not these Democrats, not this Republican. Independents decide. I am going to become an independent and go and focus on my independence and Americans' independence in general. Let's do that. Please join me in my next episode, Consumers Doctors channel. Focusing is on personalized healthcare, man. Personalized healthcare. That's what we need. Let's look look forward to having health insurance personalized. Give me back my freedom. I want freedom in healthcare. I should be able to see my own doctor. I should be able to see my own medications. I want freedom, total freedom in healthcare. Thank you.